speakers we have is Pramila Sapkota. Pramila is Bhagrat Foundation breast cancer specialist nurse. She's also a highly regarded clinical nurse consultant at New South Wales Health. I'd like to invite Pramila to the stage to share insight, awareness and valuable information about breast cancer. Thank you.
Thank you everyone for coming here today on Sunday afternoon, and you all are waiting for lunch, I know. I will be very quick, and thank you so much Nari Nikunja team for giving me this opportunity here today. I'm honored to be here today. So my topic is breast cancer, and hopefully you will get something out of it today. So what I'm going to cover today is what is breast cancer, how common breast cancer in Australia, what are the risk factors and how we can prevent that, but also talk about how we can detect early and what are the symptoms to look for, and what are the support services available for us in Australia. So before I talk about the breast cancer, just want to talk about... Can you hear me? Yeah. Oh, sorry. So before I talk about the breast cancer, I just want to talk about where actually in the breast cancer can start. So breast is made up of lobules that produce milk when we breastfeed, and we have some dots. Can you see? We got some dots here. They carry milk from the lobules. This is the lobules to the nipple, and our breast is surrounded by fatty and connective tissue. So the question is, where about in the breast cancer normally starts? So 80% of the cases, cancer starts in the duct. This is where we call milk pipe, where the milk goes from lobules to the nipple. So this area, 80% of the cases, cancer starts there. Remaining 20% of the cases, cancer either starts in the lobules, which is this, or nipple, or any other skin part, any part of the other breast. So when cancer just starts here within the breast, we call it primary breast cancer, which is early breast cancer. But when the cancer is spread out from the local area to the local tissues, we call it invasive breast cancer, which is a very formal diagnosis of breast cancer. And when it goes to elsewhere in the body, it could be bone, brain, lungs, or liver. At that point, we call it stage 4 breast cancer, or we also call it metastatic breast cancer. And at that stage, we always say, stage 4 breast cancer, we don't have a cure at the moment, but we do have a good treatments available to prolong the life and for a quality of life. But from stage 1 to 2, 3, normally stage 3 cancers are a bit more locally advanced cancer, but we do have a good treatment available. For stage 1 to 3, we have a good treatment so patient can survive from it. So if we look at the data, what data says in Australia, how common breast cancer, and you can hear everywhere, people are wearing pink, and I'm myself wearing pink today just to spread that awareness, that, you can see in different places they are doing awareness program for breast cancer, because Australia is one of the countries got highest incidence of breast cancer in the world. So at the moment, this year, the prediction for breast cancer is 20,458 women will be diagnosed, and it doesn't happen only to female, it can happen to male as well, and that number is 217 men. That is a prediction. And if you look at the ratio-wise, 1 in 7 women diagnosed with breast cancer in Australia. Just imagine if you have 60, 70 women sitting in this room, maybe out of this, 10 to 15 women got a higher chance to get a breast cancer by lifetime. So that is why this awareness program is very important, and as a female, we had to be aware about it, what to do. So every day in Australia, 57 people diagnosed with breast cancer. That is male and female including. So that's how common it is. Breast cancer is also a second leading cause of death for female after lung cancer. and that is this year prediction is 3,291 deaths expected, and also for male 36. So some of you male here, please, if you notice any abnormality in your breast, don't think that is only happens to female. You need to go and see your local GP. It is rare, it is uncommon, but it is important to be aware. But I have a good news. Australia is one of the countries that has got highest survival rate. It could be because of we have a good treatment available and they are free. It could be because breast screening is also free, and maybe more awareness here that we are sitting at 92% at the moment, whereas 20-30 years ago the survival rate was 77%. So it improved a lot. Last 20-30 years it improved a lot. So now the question is, what age group is mostly affected in Australia? It could be different in different countries. The other day I was checking Googling Nepal's data to check, and what I found was Nepal's population 30 to 50 were mostly affected with breast cancer, whereas here in Australia the affected age is mostly 50 to 75, 80% of the cases according to our data. What that means is another 20% of cases still happens from 30 to 50 as well. So we should not ignore that. So we need to be breast aware for that. And lately, I have been seeing so many young generation coming to our center. So what that means is this data can change in 5 to 10 years' time. So it is very important for us to be aware. So always I get asked question, look, I don't have any family history, why I got this breast cancer, right? So if we look at the data, only 5 to 10% of the cancer comes from the family history. So what that means is 90% of the cases, they don't have family history. So now, this is just for the awareness. What are the symptoms we need to look for? What are the symptoms of the breast cancer? So if you do a mammogram, for example, mammogram can detect very early stage of breast cancer, even from 3 millimeter. So at that point, you don't even feel a lump. Lump means girka in Nepali. So you don't even feel the lump at that stage. So what that means is you have a better survival. When you attend mammogram, it is a better survival, and I'm going to talk about that in a minute. But another other thing is every breast cancer can have a different sign and symptoms as well. So we have one breast cancer we call locally advanced breast cancer. It can be red swollen breast. It might not have a lump. But what are the common symptoms that we need to be mindful is if you see any new lump in your breast, either it can be visible or you can feel it. Any discharge coming out from your nipple, either pus or blood. Any dimpling in your skin. Any rashes in your breast. If the nipple is going inward, a bit funny shape when you compare with the other breast. And if there is any ongoing pain that doesn't go away after your period, constant pain sitting there, like what a weird pain, like I have been getting this, then those are the warning signs that you need to see your local GP. So do you know what is the main cause of breast cancer? Until now, we don't know. We don't know what can cause this breast cancer. But we do have some risk factors, and they are research evidence-based, but they are just the link. They don't have a direct cause of a breast cancer. But what they did is when they did thousands of women research, what they find out was these women who had a breast cancer, not majority, I would not say every single person, but majority of the person, they have these risk factors associated with that. So definitely strong family history, which constitute 5 to 10%. And being a woman, we can't change, right? Being a woman, 90% of the cases happens, only 1% happens to men. And growing older, you can see from the incidence that after 50 to 75, 80% of the cases. So as we get older, we got more chance to get breast cancer. Tobacco and drinking alcohol, these are not only for breast cancer, but it can happen to any other cancers as well. These are the risk factors. Starting menstruation early or starting menopause late, this is just for too much exposure with the hormone can link as well. Being overweight after menopause, taking contraceptive pill and hormonal replacement therapy, they are linked with breast cancer, but if you take for a long period of time. Normally they said if you take more than 5 years. So you need to think, if you take 1 to 2 years or 3 years, maybe it doesn't make difference. But now we do have a really minimum dose available now. So maybe, these, I think they have so much change now. So you can talk to your local GP and discuss what are the best options for you. But they increase a little bit risks to have a breast cancer. And not being physically active. And also if you got already previous breast condition, that can increase the chance as well. So can we reduce 100% cancers? No, we can't reduce. What we can do is, according to WHO, it said 30 to 50% cancer cases can be prevented if we change our lifestyle. And I think Dr. Thapa already talked about a lot of life changes. I'm not going to go very detailed about that. So maintaining healthy weight is always important. That, according to our height, if we try to maintain our body weight, that is really good. Being physically active, they said the Cancer Council recommends like 1.5 hours to 4 hours per week, maybe 3 to 4 times a week, 30 to 60 minutes, whatever thing you enjoy doing. Walking, swimming, dancing, whatever is. You just have to put that as a routine, like how we eat in your part of life, or going for a walk in the evening. Eating healthy balanced diet is important. Balanced diet means, not only carbohydrate, not only protein, but having everything, protein, carbohydrate, minerals, vitamins, everything, and fruit and vegetables in our diet, like as a daily routine. Limit alcohol. Alcohol is not good, too much alcohol not good. So according to Council, what they said is, if you don't drink more than 10 standard drink per week, if you are someone who like to drink. But from cancer perspective, we don't encourage at all. No smoking, that is another thing. If encouraging breastfeeding is also important. And avoiding this artificial hormone therapy for long period of time is discouraged. And also, if you got a family history, a strong family history, I have to say, a strong family history means in one side of the family, mother, sister, auntie, grandmother, that's one side of the family. If you got that 3 people diagnosed with breast cancer, we call that is a strong family history. And not like father side, you can't mix 2 sides, one side, or father side or mother side. In that case, that is a strong family history. You need to see your local GP, and local GP will make a referral to genetic counselor, and that will discuss what are the options available for you. And a lot of women who got very strong family history, they can start doing mammogram early age and also be breast aware as well. So how we can detect early breast cancer? There are 2 things that we can do. One is self-breast examination, and the other one is, I will talk about it in a minute, that is a mammogram. So for self-breast examination, you don't have to be a doctor, you don't have to be a specialist nurse, you can do yourself. And you can do in different 3 positions. One, when you're standing up in front of the mirror, you can check your breast. The other second option is you can lie down and check your breast. And the third option is you can do when you are taking your shower. So the best time to do this check is, if you just do before period, your breasts are tender, painful, so that's not the best time to do it. Normally, we recommend to do after period, 7 to 10 days. That is the best time when our hormones get settled, and that is the best time to check our breast. And for menopausal women who already stopped their period, they can choose one day of month, maybe first day, middle of the month, or last day of the month, whatever can remember. But also it is hard to remember this sort of thing, so in our phone, we do have a reminder apps that you can use that every month, and that's what I do. I'm very dependent on that reminders app. And other things is, now, what are the steps that how we can check our breast? There are 3 steps. First, look. Second is feel your breast, and third is learn what is normal for you. So the first step is looking at your breast and thinking that symptoms, look in front, like sit in front of the mirror and look at your breast, both breasts, how they look. Do they look normal? Is the nipple going inside? Is there any discharge you can see? Any skin texture is different there? Anything, just look at this. The number 2 is feel your breast. So the feeling of your breast is, you can always do putting your hands at the back, and then just, because that gives a room to examine the breast, just put this way, and then you can just start with these 3 fingers, start with just under the collarbone, and then go on the clockwise direction just around the breast and the central of the breast and go under the axilla as well. So you have to check everything, and then you can just do on the other side same way. So that's how you check your breast. I have left some brochures here about the self-breast examination, but also some breast screening brochures you can pick at the end of the program as well. So other second, and I really encourage you guys to attend this program, is mammogram. Mammogram is a breast X-ray. It just takes 20 minutes to do it. And if you do every 2 years, that can save your life. Because mammogram, as I said, they can pick cancer very early stage. Even like if it is a less than 1 centimeter cancer, you could actually avoid a lot of treatment. Some of the women, they could avoid chemotherapy. So mammogram every 2 years, and lucky, we are in Australia, it's free. We don't need to pay. All you have to do is take your Medicare. All you have to do is ring this number, 132050, and just say, I want to book appointment for the mammogram. And they will ask your postcode, where do you live? And then they will just book your appointment. You don't need GP referral or anything. And these 200 locations we have in New South Wales. And they will just send you maybe 5-10 minute drive, you will be there. We have so many locations available, and this is very important to do. So I'm towards the end. This is my last slide. So if you feel a lump, what do? You're checking your breast, suddenly you feel the lump or some unusual things. What would you do?
Scan.
So the question is, your first go-to person is your local GP. The support starts from there. So you go and see your local GP maybe within 3 days. Don't delay, because we don't know how cancer behaves. Some cancers are very aggressive type. So within maybe a few days, go and see your local GP. And local GP will do a triple test called mammogram, ultrasound, and biopsy. And they will, once every information comes back, then they will decide where to send to you, whether medical oncologist or sending to a surgeon. Depends on the pathology, because nowadays we do have some aggressive cancer called triple negative. Some of this time, this patient can benefit from sending to the medical oncologist, because that is the latest thing. And they will decide where to send to you. Another, maybe a lot of of you maybe not aware about Magra Foundation. Magra Foundation is a charity organization, and they have the breast cancer specialist nurses. And this service is available for free in all over Australia. And at the moment, we are 204 nurses. We cover every area. So how you get, because these first 2 weeks, when you are actually waiting for a specialist referral, you got a diagnosis from GP, now you are waiting to see a surgeon. That time can be very, very stressful time. You need someone to guide you who have knowledge and skills on that topic, right? So what you can do is you can contact Magra Foundation Breast Cancer Specialist Nurse. As I said, it's a free service, and it's available Monday to Friday office hours. And how you can find that number is go to the website magrafoundation.com.au, and on the right hand side it says find a nurse near you, and you need to put the postcode. And then once you put the postcode, that nurse name comes up with the mobile number, and during office hours you just give them a call. And these nurses, what they do is they will support you from the time of diagnosis and throughout treatment towards the end. They answer your question. They will navigate you in the healthcare system. They will even explain what that pathology means to you and what are the predicted treatment can be. And a lot of support, constant emotional support you will receive. You will not be lost in the system. And these nurses will be like your friend. You can call during office hours. Any question after you see your specialist, if you don't understand, if you want to have a simple language, explain things to you, you can contact these nurses. And this Magra Foundation was established in 2005 by Glenn Magra, who was the cricketer, when his wife diagnosed with breast cancer. And they had access to a specialist nurse. And at that point, they found that this service was really important in their life. And they decided that every woman diagnosed with breast cancer should receive this service. And they established this foundation, and now they started with 4 nurses in 2005, and it's growing. We are now 204 nurses all over Australia. So other services now important for you is Cancer Council. You can go to that website for resources and support services. Breast Cancer Network Australia, National Breast Cancer Foundation, and breast cancer clinical trials if you want to participate in anything. And please spread this awareness to your sister, mother, wife, anyone that breast self-examination is important and breast screening is important. Thank you so much.
That was very informative presentation. Thank you, Pramila Sapkota, for your valuable contribution on this crucial matter.